And we are back on the Zero Hour. I'm your host, Richard RJ Eskow. I always look forward to speaking with our next guest. Lynn Parramore is a author, a cultural critic, and writer. She covers a variety of topics, and we will discuss at least one of them today. Perhaps we'll get into others. You may remember the story a while back about an emergency room doctor who challenged, well, I'll let Lynn tell the story, actually. Lynn Parramore, welcome back to the program.
Hi, so nice to be with you, Richard.
And so good to have you. Listen, I started to summarize this story because I remembered it, but better you should. So tell us about Dr. Ming Lin.
Well, Dr. Ming Lin is someone I've gotten to know in the last year and a half, and he was working at a hospital in Washington State when the pandemic broke out. And he was very concerned that there weren't enough safety protocols in his hospital to protect both the staff and patients. And he tried to make complaints through internal channels, and his complaints were ignored. And he became so frustrated that he eventually took to social media. He posted on Facebook about his concerns, and he was promptly fired from his job that he had held, I believe it was 17 years. So interestingly, in this case, it wasn't the hospital itself that employed Dr. Lin. It was actually an entity that was owned by the private equity firm Blackstone. So this case shows how doctors fare when they are employed by business corporations that are not really interested in people's health. They're interested in the bottom line. And it's a phenomenon I've learned more about lately. There are corporations called contract management groups that have been staffing hospitals and other areas of medicine for a while. They've been doing it. They kind of got going in the 80s and 90s, but there's a lot of profit to be made there. And soon enough, the private equity companies will sniff out where the profits are. And they've begun to take over these contract management groups. They've also been taking over nursing homes and any number, even like billing companies, to make sure they don't lose any dollars in what's going on. And studies have shown that when private equity firms get involved in medicine, bad things happen. Patients, the quality of care goes down, the cost goes up. And there's a real cost that I've learned about to practitioners of medicine too, who face this terrible conflict between what they really see as their calling, to
Right.
help people get better, and what these corporations expect from them. The private equity is sort of corporate medicine on steroids. They're looking for 20% returns to shareholders, and so they're not kidding around. They're going to cut corners. They've been trying to fire doctors during the pandemic because doctors are expensive, and replace them with non-physician staff, really cutting corners. And a growing chorus of doctors as well as patient advocates and patients are saying, this is a disaster in the making. This is really becoming dangerous.
Well, and I know this is small, relatively small compared to the gravity and scope of the problem you're describing, Lynn Parramore, but also I've seen that these fiscal agents or intermediaries diminish accountability and corporate, rather community responsiveness. That when they come in and all the doctors in a hospital, for example, suddenly work for this other organization, and you want to call the hospital manager if you've been badly treated in some way or whatever, or if you feel the hospital should be providing more asthma care for children, or just pick anything. But there's really no accountability anymore. Well, that's not us. That's Medicorp, and Medicorp sets their own policies. So medical care gets more and more alienated from the patient, more and more alienated from the neighborhood and the community, and all in the name, I think, of profit.
That's exactly right. These private equity firms in particular, when they take over a company, they're looking to flip it. Now they'll take over management and they'll stay around for a couple of years, but they're not really invested in the community. They're not really invested in relationships with medical staff. And they're not really invested in the outcomes for patients. They're interested in the bottom line and fairly short-term returns for their shareholders. And it really puts the doctors in a terrible position because things are getting billed in their name. Billing occurs and they have no idea what's being billed. Their patients, get a $2,000 bill in the mail, and they think, "Oh, Doctor is responsible for this." Actually, Doctor X may never have even seen the bill. So one of the things that these physicians that I've been speaking to are advocating is transparency, that they be shown all billing that is done in their name without having to, specifically request it. And there are practices called fee splitting, which is considered unethical in medicine. You're not supposed to split physicians' fees with other non-physician entities. And that has been going on. A lot of really unethical things. Actually, in many states, there are prohibitions, there are laws prohibiting doctors from being directly employed by non-physicians. But those laws are gotten around by these corporations and private equity firms by sort of, sticking a couple of doctors in at the top as executives. And some of these doctors are, interested more in making profit. It's a small group of them, but they make things and they're actually profiting on skimming, the salaries of their fellow doctors, their fellow emergency room physicians. And emergency room doctors are in a particularly tight spot. It's a very demanding job. Obviously, we've seen that during the pandemic. And it's hard for hospitals to make sure that there is staff there 24/7, that physicians are available. So all of this sort of got going in response to a legitimate need to have appropriate staffing. And the groups that were managing contracts were originally formed by physicians to meet a legitimate need. But, some of them found out how much money they could make and sold out to corporate interests. And, the Wall Street was sort of off to the races, and they're heavily, heavily involved. I think it's 50% of emergency room doctors are now employed by some kind of corporate entity. And so it's really, it's been described by Gretchen Morgensen as a seismic shift in medicine, and one that is quite frightening. You would think that when you go to the emergency room, that the person who decides if you're going to get a breathing tube is the doctor, but that really may not be the case. In fact, a private equity firm, Steve Schwartzman, may decide whether you see a doctor at all. And that's by money he can make off of you.
And that gets to the question I was going to ask next, Lynn Parramore, which is, and of course, this is not restricted to emergency rooms, right? I mean, this is many departments in hospitals and private practices as well are being acquired, I think. But to what extent is this equity practice affecting the practice of medicine itself? I remember the days when, I would read from my work magazines like Medical Economics that told physicians, well, you've got to have a turnover of a patient every X minutes or you're not making money. But now I suspect that the equity company itself may be telling the physicians what to do and how quickly to do it and so on. Does that in fact happen?
Yes, they are losing autonomy. They're losing decision-making ability, and it's impacting them so severely that a lot of them are leaving the practice of medicine because most people go into medicine for very good reasons. They feel they have a high calling to serve humanity, and here come these corporate entities telling them, no, a patient is a source of profits, and you're the tool for extracting it. That's a very depressing and disheartening position for a physician to be in. In fact, I've heard Wendy Dean, who is a psychiatrist who studies workforce, psychological issues. She's described it as moral injury. It's something even more profound than burnout. I mean, burnout, you think of someone who doesn't have the resources to go on. They're just too tired. There's too much going on. And that does happen. But she says what she's seeing now with the increasing influence of corporate medicine and private equity in particular is moral injury, the kind of thing that we used to talk about soldiers experiencing.
Right, exactly.
things that were against their value system. So she thinks this is an appropriate term to use for doctors, and not just doctors, but all medical staff who are really being pressured to do things that are not in the patient's interest and out of alignment with the values that they have been taught to uphold.
So, what would be an example of that? Would it be, for example, someone comes into the emergency room and it appears as if they need to be admitted for further testing, but maybe the physician is directed, no, don't admit them. Is that the kind of thing, or is it something else?
Yes, it's and it's also physicians being pressured not to speak out when they see something wrong at the hospital. That was what happened to Dr. Ming Lin. I mean, he was trying to keep patients and staff safe, asking for safety protocols for COVID, and he found out that if you speak up, you will be shut down. That the corporate entity does not have any interest in your perspective as a doctor on what's safe and what's not safe. And these doctors are being fired without due process. They have often in their contracts, stipulations that they can be fired without cause. Now, it used to be that physicians within hospitals would, oversee the safety issues and protocols, but that is no longer the case. And so again, you want Steve Schwartzman deciding what's safe in a hospital. If they see another doctor, for example, if they see a doctor who's doing things that are unsafe, or a doctor who maybe has a problem with alcohol or substances or whatever it is, something that's an unsafe situation, if that doctor is making money for the corporation, they do not want to hear about that problem. I've been hearing this from physicians too. They're encouraged not to report or speak out against other doctors that are moneymakers.
And the flip side of this, I guess I would say, is that while they may protect their, revenue producers, that it sounds as if, in a sense, physicians are becoming gig workers almost. That where they used to have a certain, and nurses, I'm sure, and other people, professionals as well, that and staff, that where they used to have a certain amount of protection as employees of the hospital, now it's like, no, if we don't like you, we'll get the next person. Is that a fair analogy, you think?
That's really fair to say, and they're finding it. This is not what they signed up for when they went to medical school. They didn't envision that they would be gig workers for for large corporations, and these corporations are coming under fire. Two of the largest are Team Health and Envision. And I was just reading an article in Forbes magazine. The famous short seller Jim Chanos called Envision Healthcare a scam, just a flat out scam, that their business model is dependent on aggressive billing, overbilling. They've been called out for surprise billing. That's when you think your doctor's
Right.
in, but then you get to the facility and it's not a network. And these private equity firms and corporations have many tricks to make money. One of them is to push doctors out of network, so
Right.
they pay these fees. And another one, I mentioned before, is replacing physicians where they're really needed with non-physician medical staff. So the interesting thing about this, I was asking, some of these doctors, okay, what do we do about it? And they really, they say Congress has to act, and hopefully we could get some bipartisan support for this, because everybody has a good chance of ending up in the emergency room. I think that's one reason why this particular arena is a good one to highlight. They don't, Republican, Democrat, young, old, we could all end up in the emergency room. In fact, 1 in 5 end up there every year. In a normal year, the numbers have ticked down a little bit during COVID, but they're actually back up. But we have a high likelihood of being there, and I think most of us would agree we would like for private equity tentacles not to be reaching in there and deciding if we get a feeding tube.
Yeah, it's the one place you really don't want them cutting corners is in life and death care, which so often takes place in an emergency room. So,
One other thing I would mention,
sure.
doctors have told me about that I wasn't as aware of, but they've made it very poignantly clear. They are dealing with all the other manifestations of inequality in our society, because more and more people don't have the ability to pay for insurance and pay for the costs of medicine, and end up in the emergency room. People who have substance problems, people who have mental health issues that aren't being treated anywhere else. They're kind of ground zero for dealing with what's wrong with our society. So they are, being stressed in that way too. And I really began to feel a great deal of compassion for them on that front.
Yeah, absolutely. And of course, that's one of the reasons why I think, since so many of their patients, if we're talking specifically about emergency rooms, are vulnerable. That's one of the reasons I imagine why equity investors figure they can get away with it. They love to target their, vulnerable populations for this. Well, what can people do, really? I mean, those of us who see this and are, well, you and I can write about it, but I mean, what can those of us who are concerned do as citizens about something like this? Any thoughts?
Definitely pressuring your representatives to either at the state and federal level to enforce the laws that are in place that make it, that prohibit doctors from working for these corporate entities, and then make laws where there aren't any existing. And one of the things that we talked about, a number of the physicians said this would be item number one, is to have transparency on the billing so that doctors would know what's being billed in their name, patients would know, and the doctors could tell whether something is being charged fairly or not. And they could also see, how much of their fee is perhaps getting skimmed off by managers of these corporations. It's sometimes as high as 20 or 30%, but they don't know it. They don't, they don't see the bills, and so they don't know. They don't see the paperwork. So transparency is one of the main things that we want Congress to work on. And I think the other thing is finding out is your hospital are the contracts for medical staff backed by a private equity firm? If so, you may want to choose a different hospital. I mean, sad to say, but you may want to do research on that.
No, and of course, I'm for full-scale socialism when it comes to the medical system and just get all these bastards out of it, but that may take a little longer,
That is exactly right. In the end, practice of medicine and corporate interest are totally, they're not compatible at all, and they need to get out. No other country allows this sort of thing to go on. It's the U.S. It's where we're an outlier in a very disappointing and dangerous way in this case. Nobody else lets this go on.
Disappointing, dangerous, and deadly. So, now, of course, all this is happening in the context of a pandemic, and instead of doing what you'd expect, well, my opinion anyway, instead of doing what you'd expect a rational society to do when faced with a massive health crisis and hundreds of thousands of deaths, organizing our system more wisely, you have written about the Libertarians and their reaction to this. I mean, I've been wanting to paraphrase, Will Rogers said, your freedom to swing your fist ends where my nose begins. I wanted to say your freedom to cough your germs ends where my nose begins too. But any thoughts on the kind of libertarian backlash to reasonable healthcare precautions in the United States?
Yeah, I mean, really, to ask a cancer patient, for example, to go into a medical facility where some of the staff are not vaccinated and may have an infectious disease that's potentially deadly to them, to all be immunocompromised, and as we've seen, to just anybody, we don't know who's going to succumb to COVID and who's not. To ask them to take that risk because they don't want to affix, to get a vaccine or affix a piece of cloth over their nose and mouth, just ridiculous. And it's, it's this idea of freedom for me, but death to the rest of you. That's not how we operate as society. It's a really perverse way of looking at, one's obligations. Freedom is about responsibilities and obligations to others too.
And you know what baffles me? I wrote about this many years ago and attempted to get, you know what baffles me about all this, Lynn Parramore, is that, okay, you know, people can have conscientious objections to doing certain things. But for example, if I had a conscientious objection to firing a gun during the Vietnam War, I could apply for conscientious objector status so that I didn't have to go into the army. I couldn't say, well, I'm going to go into the army but refuse orders to fire a gun. You know, firing a gun is the gig, right? And if you don't want to do the gig, don't take the job. But it seems to me that the pharmacists who don't want to dispense birth control pills, or the people who are conscientiously supposedly opposed to, maybe they are, to getting the vaccine, want to go into a nursing home or an emergency room or a ICU. Look, if you don't want to get the vaccine for ethical reasons, then get a new job. And I know that sounds callous. I'm pro-worker, and this is a hard time to get a job. But there reaches a point where, you know what, you can have your own conscience, but you can't endanger others with it. And I don't know why this isn't, you know, the sort of conscientious objector analogy isn't, you know, common sense.
Yeah, I mean, you don't get to smoke a cigarette in the hospital if you work there. I mean, you're not allowed to do this. We have laws in place that protect our fellow citizens, and your job is to keep people safe. That's your number one priority. And if you have something that conflicts with that, then I think you do need to find another profession, unfortunately, another job. I mean, and the interesting thing is, your freedom has limits when you live in a society. And libertarians, you know, seem to forget, actually, the government can ask you to do very extreme things with your body. For example, you can be drafted into the military.
Right.
I mean, if you don't sign up for the selective service, it's a felony. And, you know, we haven't had to do that. We haven't had to do a draft in a long time. But in any major war, it's very likely that a draft will have to happen because, you know, surprisingly enough, people don't like to volunteer to get blown to bits. And it's very hard to get people to sign up voluntarily when there is a large scale war going on. So the government can step in and tell you to take your body and put it on the front line as cannon fodder. So the idea of being asked to get a vaccination or wear a mask is far less intrusive. And there are other ways that the government can interfere with your body. If you, for example, are on trial and you have a psychiatric condition, you can be forced to take medication for that psychiatric condition. I mean, there are these circumstances in which your individual freedom is restrained by the government.
Yeah, if you're adjudged to be a danger to yourself or others, or, you know, what's fascinating to me, and by the way, during the draft, people were burning their draft cards. I protested in a uniquely Richard Eskow way, which was I lost my draft card and I've never found it, but never got in trouble for it. But what fascinates me about this, as someone who, you know, I try to have compassion for everyone, even, you know, if they're being part of a, you know, thundering herd of insanity or whatever. But what fascinates me about this is the psychology that leads people to thinking that of all the things we're not allowed to do, we can't drive on the left side of the road, we can't run a red light, we can't drink and drive, we can't, you know, you name it. Or, you know, that soldier who wrote the letter and resigned, the colonel who resigned and made a big deal out of it because he thought it was unconscionable to be ordered to take this vaccination when, as somebody pointed out, he had already taken 4 others, because every military draftee has to get certain other one. You know, it fascinates me why this is the hill they want to die on, or let us die on, because and there's got to be a reason, right? So to me, one of the reasons is mistrust of authority. And some of the reasons are kind of at their root probably good. You know, I mean, pharmaceutical companies aren't trustworthy. We know that. But it's been transmuted into this, you know, epidemic of irrational, you're not the boss of meism. And, I don't know, you have any thoughts on that?
I wish I could, after looking into this corporate medicine issue so closely in the last couple of weeks, you hear a lot of people sort of ranting about get the government out of healthcare,
Right.
But I wish we could turn that anger towards corporations and say get the corporations out of medicine because they do far, far more damage. So it's a distrust and an unease that is being directed to the wrong people and wrong source. I mean, I understand that people feel mistrustful of institutions. I feel mistrustful of institutions myself. And the government isn't perfect, and the government
Right.
does bad. The government is also the only thing standing between you and corporations that are sociopathic. I mean, they really see you as a statistic on a spreadsheet and a source of profits, and that's it. They don't care about your life at all. It reminds me of, you and I sometimes have talked about John Ruskin, the 19th century critic.
Right.
The only wealth is life. And these corporations are anti-life. They absolutely do not care about what is good for the well-being of humanity and of their fellow citizens.
You're absolutely right. But as a cultural historian and critic, I mean, it also seems to me, Thomas Frank, who comes on the show fairly regularly, has talked, and others have talked about the culture of democratic and liberal politics, which has become very, you've heard the expression PMC, professional managerial class, and the kind of college-educated, higher-earning subset of the population becomes both the staff and political leadership of the Democratic Party and the base. And I think there is also a tremendous not exclusively white, although primarily white, working class resentment of this. And I feel that somehow that must tie into this. Oh, they all think they're smarter than me, telling me I got to take this shot, until I have to listen to Dr. Fauci or F Dr. Fauci.
It's a way of asserting control over your life in perhaps circumstances where you don't feel that you have much control. And so that's the way you're going to channel that resentment, that legitimate resentment and anger. And, a lot of
Right.
people in rural areas, public health has really deteriorated in our country, and they don't have much interaction with the healthcare system. And they don't have, sort of a family doctor who they trust that they can go to and talk about their vaccine fears with. So the fact that they're mistrustful is partly due to inequality, and also
Right.
the responsibility adheres to the Democratic Party, which has abandoned some of the areas in which the most, you have the anti-vax movement, most strongly manifested.
Yeah, it's such a fascinating, complex set of issues. But before I let you go, I know you wrote also about, speaking of libertarians, about a phenomenon that fascinates and horrifies me. There are always new ways to be horrified in this country, and the latest among them being the Texas vigilante abortion law that basically says, it's basically bounty hunting, right? I mean, it's basically you can get $10,000 if you find a doctor that's committed to performed an abortion, or a woman that's received one. It's actually law enforcement is now, I'm going to get me, a doctor and get my. I'm the first guy to claim it, and it was a man. Said I'm not anti-abortion. I just want $10,000. I mean, this to me is bizarro world, and you wrote about it, so I'm curious your thoughts about that.
Call it the Texas Taliban. It's grotesque. It's a complete subversion of what the laws intend, and an utter dismissal of women's constitutional rights. And if we can't deal with the Taliban in Afghanistan and their impact on women, perhaps we could turn our attention here. And libertarians who talk about freedom all day long, I have freedom not to get a shot, I have freedom not to wear a mask. What about the invasion of a woman's body such that she would be forced to bear the child of a family member who raped her.
Or a moron like the people who passed this law, excuse me, but to pick another one, horrifying thing to contemplate. Yeah.
Call it what it is. It's torture.
Yeah.
To be forced to undergo a physical experience that can, is of such life-changing and actually life-threatening, consequences. Pregnant, you have a baby, your body is ripped open. In cases, it's an incredibly painful experience. Now, people who want to have children accept that pain and that extreme burden of carrying a child to term because they really want to have a child. But if you don't want a child, it simply constitutes torture of a horrifying kind. And libertarians are always, the first to say, well, we're against torture. And they don't that logic seems to escape them in this case. And the other thing I really like to throw out at them, they're worshipers of Ayn Rand. And it just so happens that Ayn Rand thought that it was repellent and idiotic for anyone to suggest that a woman's body could be commandeered in this way. She was pro-choice and thought that anti-abortion arguments were moronic, and said so in no uncertain terms. So, Rand Paul, I believe he's named after her.
No, he says he's not. I looked into that, Lynn, and I think there's a relative. I think it was Randall originally. I don't know, but...
Well, we know he's a libertarian, and he's a very influential one, and he is absolutely going against the thinking of one of the founders of his, political religion. So I think that's very ironic. Of
course, you have to, pick, the Ayn Rand year when she wasn't on, speed or whatever. So the other often one of the thought exercise I always go through is, well, okay, what if you passed a law saying that if you have good kidneys and you're a man and someone else needs to be like hooked up to an IV, lying next to you in bed, hooked up to an IV for 9 months. Can we pass a law saying, yeah, you have to do that? You have to do that as a man. You have to be hooked up to this person, whether you know them or not, this stranger for 9 months, and you have no choice in the matter. And if you try to leave, somebody can get $10,000 for reporting you. I mean, I don't think they'd call that an assertion of freedom. So I don't know any other way to look at it than they think that women are chattel.
And they have a very deep, frightening desire to control women's reproductive processes for reasons that I think are psychologically very intense and profound. And this has been going on, since the ancient Greeks. I mean, the ancient Greeks perceived a baby as the result of a man's sperm growing inside the woman's body. The woman's body was merely a receptacle. We seem to still have an echo of that in our society, that a woman's body is just there to be commandeered at any time and used as a receptacle for a man's sperm, regardless of what she herself thinks about it. And it's not just an affront to the woman herself. It's extremely damaging to the woman's family. There are studies that have shown that when a woman can't get an abortion and is forced to have a child, her children that she may have had prior to that pregnancy suffer as a result, due to economic constraints and lack of resources. I mean, not to mention the fact that if you have a baby that has severe, let's say, a severe disease or a severe disability, that again, the resources of the rest of the family, have to be, decreased to take care of that child. And it's detrimental to the whole society to put families in these kinds of economic dire straits. And, everybody makes the point. I don't see these Republicans making provisions for childcare and expanding Social Security and expanding help for children that have severe illnesses and severe disabilities. So, it's the burden totally on the woman.
With your cultural, I think it's all about fear of feminine power. I feel that it's all, you're a cultural historian, whether it's, the image of the succubus or vagina dentata or that Eve was, the generator of evil by seducing the man after she was seduced by that female sexuality just, I think, has terrified many men and who have, inculcated that in others as well. But for many centuries, and that this is just more of a way to try to chain what they see as a beast that could devour them if they're not careful.
Yeah, it really is, and it is really, really deep. One of the deepest forces that I think is working here psychologically and culturally is it sort of goes back to Plato and this idea of trying to transcend the realm of matter, transcend the processes of life, and imagine ourselves as immortal. Obviously, this shows up in all the major religions. Or I think Judaism doesn't necessarily have the afterlife as we think about it in other religions. And maybe that's an exception.
That's essentially right. Yeah, there are some sects of Judaism that do, but generally no. Yeah.
Awesome. The human population would like to think of some kind of immortal existence, and so a woman's body is a reminder, in-your-face reminder, that there are cycles of nature and cycles of birth, which implies that there will also be a death.
Right.
And blood. And there's this physical manifestation that reminds you that you are a creature that has much in common with other animals. You're not this separate, transcendent being that doesn't have to follow the rules of nature. And I think that's one of the reasons that women's bodies and their reproductive processes strike such fear into the hearts of many.
Yeah, plus who knows what other dark things lurk in their psyches, but 10 grand, wow, it's just, I'm not over that yet.
Yeah, incentivizing the greediest people who, as you say, don't even care about this issue at all, and just to grab the cash and to grab that cash at the expense of not only a woman's well-being, but the well-being of her family, and ultimately the well-being of society and the economy for that matter. Women can't function in jobs or in the workplace when they can't plan how many children they're going to have. That's insane.
That 10 grand just strikes me as the moral equivalent of the bounties they used to pay for freed slaves. It's just, wow. But anyway, we're going to have to leave it there. As always, Lynn Parramore, wonderful discussion, fascinating discussion. Thanks for your writing on this topic, and thanks for coming back on the program.
Always fascinating and enjoyable to talk to you and get to explore these issues. We don't get to explore in that many places in this depth.
Thank you. And we'll be right back after this. I'm Richard RJ Eskow, and this is The Zero Hour.